60% of maternal deaths occur within the first few weeks after childbirth, according to Dr. Brown from the Contemporary OBGYN Journal. This is a problem that's across the board in the United States and is something that we need to take a closer look at. I know firsthand what it's like to suffer from anxiety and depression postpartum after giving birth, and so I think there's ways that we can help change this for new moms. The first thing that I believe needs to be changed is how soon new moms are seen, or moms are seen after giving birth. Typically, the CDC states that new moms should be seen between 6 to 12 weeks postpartum. This is a problem because a lot of new moms, or moms in general, are suffering alone for the first 6, 8, 12 weeks before they're seen postpartum or after having their baby. A lot can happen in those first few weeks, which are the hardest for most moms, and I believe that screening new moms sooner can help reduce a lot of health problems, and anxiety and depression can be caught sooner. So at that first appointment, how are new moms screened? So that's the next thing we're going to talk about that possibly needs to be reformed. New moms are screened with the Edinburgh Depression and Anxiety Scale, which is a standard screening by the CDC and the American College of OBGYN. And so it is a screening tool that is done, like I said, 6, 8, 12 weeks whenever the new mom is first seen. And it's a very vague scale. It's strongly agree, strongly disagree as far as anxiety, if you're feeling anxious, that kind of stuff. And so I believe this needs to be more thorough with possible, written answers. How are you feeling? What's going on? Because new moms need to be taken care of. They can't take care of their babies without being taken care of first. So I think that that's key to helping new moms. So, seeing them sooner within the first 1 to 2 weeks, and also having better screening tools in place for new moms to test for anxiety and depression. Not only is it key to check on them sooner for their emotional well-being, but also for physical well-being as well. A lot of new moms had a C-section, so they have the incision. Our new moms had vaginal birth and possible complications with that, so it can be very painful. So I think that checking on new moms sooner, making sure they're healing properly, and making sure that physically they're healthy as well as emotional. Another physical aspect that's key in seeing new moms sooner is making sure that breastfeeding, if they decide to breastfeed, is going well. It can be a very physically demanding side of being a new mom, physically and emotionally, especially if maybe the new mom isn't producing enough milk. So seeing new moms sooner can help make sure that their milk supply is coming in properly, to make sure that they're not sore, to make sure that if they are sore, that they're holding their baby properly for breastfeeding. All those aspects, if they're caught sooner, new moms can have more success with their babies as far as breastfeeding, or just overall as far as their mental health. So the last key point that I think needs to be addressed to help new moms is a standard across the board for support groups. Maybe a possible mandatory attending of one support group after you had your baby, and making sure that you have the support you need, because it's key to make sure you don't feel alone as a mom. Especially new moms can be very lonely. So I think it's super important to make sure that there is a support group led by moms and other moms maybe in the area, so that way you can feel supported and have other people in the community to reach out to if you have problems or questions about anything pertaining to having a new baby at home, which can be very overwhelming. I know that firsthand. So just to kind of recap, I think that it's key to be seeing new moms sooner, like 1 to 2 weeks, instead of the standard by the CDC, which is 6, 8, 12 weeks-ish. I also believe that a new screening needs to be put in place other than the Edinburgh, something more thorough that is possible written answers instead of just strongly agree, strongly disagree. So that way the provider can get to know the mom and make sure that they are okay and their baby is okay. And then the last thing is support groups, possible mandatory support groups, ways to get to meet new moms in the area and to not feel alone. So I think that talking a lot today about being a mom and knowing that there needs to be a change in helping moms, I think that those things will all be very beneficial to help not just the moms, but to make sure the babies are flourishing as well. Thank you.